Hello, nursing students. Today I'll be walking you through several of the ATI simulation processes that you will be using during your clinical simulations. By the end of this video, you will be able to demonstrate the correct medication scanning process and perform the third medication check using the barcode verification system that we have. You will also learn how to accurately document medications in the chart, safely administer oral and liquid medications, identify and respond appropriately to medication alerts, and access, interpret lab results, trends, and diagnostic imaging during your simulation. So let's get started. All right, so in the last video, you learned how to take out your medications from your Pyxis, and you are now walking over to your patient's room, medication cup in hand, ready to administer them to your patients. Before administering the medication, you should explain to the patient what each medication is, what it's used for, and any other important teaching points that you need to know. After explaining the medication, you will then move on to your third check, which is the administration of the medication. So let's get started. Come on, let's walk over there right now. Okay, so this is our patient's room where the environment that we have set up for our simulation will be held. It'll look exactly like this with our patient right here, patient monitor to the side, and our little ATI scanning system on our computer next to the patient right here. So let's head over here so that way you guys can see. Quick, camera two, boom, here we are. All right, now that we're here at the bedside, the scanning process begins with the patient's medical record number. This number is located within the QR code on the patient's wristband, right next to the patient right here. Let's move them up a little bit so you guys can see it. And the patient's medical record number is located right here on his little armband, and it should look something like this right here. Okay, so the scanning process begins with the patient's medical record number. This number is located within a QR code on the patient's wristband. You will scan that QR code on the patient's wristband to access the patient's medication administration record, also known as the MAR. Once the wristband has been scanned, the system will take you directly to the MAR, where you will see the list of medications ordered for the patient. From here, you can begin scanning each medication one by one and document them in the patient's chart. Now, I recorded these videos a little bit separate, so I'll take you over to that side right now so you can see what it looks like on the computer. Once the QR code on the patient's wristband has been scanned, it'll take you directly to the MAR, where you guys will see all of the patient's medications. And from here, you can start by scanning each medication one by one and updating the patient's chart afterwards. So let me show you what I mean by that. So my patient here, Dwight Schrute, has an acetaminophen or an oral tablet at 325 milligrams. All right, now that we're on the MAR, we can see our medications. Let's scan the first medication that we saw in there, which is our acetaminophen tablet right here. So let's scan it. And a little menu should pop up with more of the medication information of the medication you just scanned, and the dose, the actions that you're doing, such as giving it, starting it, holding it, the patient maybe refused it, and the time right here. The time is always going to be morning shift. You're always a morning shift relieving night shift, so the time will always be around 7:45 to 8:30 from your sim. All right, you guys saw in there that the dose was 325 milligrams when you scan one of our tablets right here. But say the order was for 650, you would grab another medication, another acetaminophen right here, and you would scan that one as well. And let me show you guys what it does when you scan it. Right there. The dose went from 325 to 650, and then from here I can hit update chart. But what you can do as well is scan another medication. And that's exactly what we're going to do. We're going to scan another medication. I've assessed that my patient is still in pain, and so now I have morphine prescribed to him right here, thanks to the doctor. What you will do is you will scan this medication, and I'll show you guys right now how it looks like on the chart. There we go. Once I've scanned my morphine, it now shows that I have two medications within my chart. And let's look at the morphine. Here you guys will see all the exact same instructions as the acetaminophen. You guys will see the dose, the frequency, the route, start and end time, dispensed, which is an injectable for the morphine, approving provider, which is Dr. Poor, The only difference between the tablet medications and the liquid medications is you guys will actually be drawing up the medications and inputting how many milligrams you are giving. For example, this morphine right here is 2 milligrams over 1 ml. So I would pull out 1 ml. But for the dose, I would say I'm giving 2 milligrams. One important thing to keep in mind when you're drawing out your medications, in this case, we have pulled out 1 cc. You want to make sure that you verify that with your instructor so that we know how much you withdrew from that medication. So you've gotten your morphine, you've drawn it up, and now it's time for you to verify it before you hit update chart. So you will go up to your instructor, who's usually sitting over here, and you will verify the dose with your instructor and verify that it's correct. There's nothing in it right now, for example. And once you have verified that it is all done, that is when you will hit update chart. Right there. Update chart. There we go. It should say your medications have been given. And if we scroll down here, I can see that my acetaminophen was given and my morphine was given. And that's how you guys scan medications into the ATI scanning system. Now, after a while, ATI does have some form of expiration time, so you may have to rescan your patient's wristband if it prompts you. So it may give you a little prompt saying, "Oh, please rescan your patient's medical record number." In which case, you would just go ahead and scan the patient's wristband again, and it'll take you directly back into the MAR. One thing to keep in mind when handling your PO medications, please do not open them. The only reason why you would need to open them is if you were cutting the medication in half. So if your dose was 325, but you only have a 650 milligram tab, that's a situation where we'd want to see you guys cut it in half. If not, the patient can just take all the pills at once, just like this. You don't need to open them. And any injectable medications, as you guys can see, will be put right here onto his right deltoid right here on the injection pad. You guys will only ever use equipment you guys have used in your practice. So please inject the mannequin right here on the injection pad. And if possible, do not open up any of the medications unless you are cutting it in half. Okay, now that we've scanned an update chart, now it's time to administer the medication to our patient. The way that we would administer the medications, like I said before, please do not open up the medications. So just like this would be fine. You have your little med cup right here, and you will ask your patient, can you take them all at once? The patient will respond with yes, and you will give them all the PO medications at once, and have your little water here to wash it down with. Boop, 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 boop. And there you go. You've now just administered your PO medications to your patient. Now, with liquid medications, like we said before, you will have drawn it up by now and you would have shown it to your instructor and verified the volume that you have taken out. And once you have done that, you will inject it into the deltoid of the mannequin on the injection pad on his right arm right here. We will not give you guys anything you haven't used in your practice. So if you've used it in your practice, it's most likely going to be used in the simulation. Okay, now that you guys are a little bit more familiar now with the scanning and the administration of the medications on ATI, let's move over to how we will obtain lab and diagnostic imaging throughout our simulation. Let's go. In addition to medication administration, you are responsible for monitoring laboratory values during the simulation. Admission labs are typically already available for you to review. For example, my patient Dwight Schrute right now has admission labs that I can look over. And that's going to be under your results tab and labs. I'll show you right now. Let's get a closer look on what that looks like. If I look into my labs, I should see some starting labs right here. Dwight Schrute has a white cell blood count of 16.4. That's a little concerning. That could be an infection right there. And everything else seems normal. Okay, perfect. Now that I was able to see the labs, I would then want to call the doctor in order to update him on the information. We have a separate video for calling for calling the doctor and lab. If you want to check out that video, it's listed inside the same modules this video will be listed on. But for right now, let's just focus on what to do once I've received the verbal order from my doctor to get a set of repeat labs. To request labs, you will actually be using your phone to call on the number that we have listed. That's on a separate video if you guys want to check that out again. You would introduce yourself, provide the patient's medical record number, and request the new set of labs that have been ordered by the doctor. After the labs are confirmed, they will send you updated results to your system. Let me show you what that looks like. Okay, and once you've called, you need to refresh your screen. There is no refresh button on this web page, as you can see. So the way you would refresh the page is just tab something else, like for example, patient information, and then go back into your labs. There we go. And then here you guys can see that there are some trends right here. You guys are able to see, you guys are able to compare the initial labs with the repeat labs. And for example, now I can see that his sodium and potassium are low. So this now tells me this is an electrolyte imbalance, which I will then call the doctor about, and they will give updated information. They may give me a verbal order on PO medications. Maybe I need to give some potassium. But that is how you guys will obtain labs throughout your scenarios. So the diagnostic imaging results follow a similar process. If your patient has an order for imaging, such as a chest x-ray or ultrasound, you would, again, pull out your phone and call the radiology department and provide the patient's medical record number. Radiology will then send the imaging results to your system just like the labs. You will need to refresh your page by just going to another tab, and then you will be able to view that image in a written and image interpretation of the results. Let me show you what it looks like again. And again, you would need to tab in, tab out of another screen. So again, let's just go to patient information. And then now let's go into my imaging and diagnostic tests. And there you go. You guys can see that he has a chest x-ray right here and it's all normal. And it's right here. You guys can view an image of the screen right here. To exit this view, just click again and you guys should exit out of there. And it should have some form of description right here. It may be longer throughout the sim. This is just a little example, but you guys will have a little explanation of what the diagnostic test resulted in and what the result is right here. Whether it's a chest x-ray and it's normal, here it is. And that is how you guys receive imaging and diagnostic tests throughout your simulation. Okay, guys, some final reminders. Just remember that you may need to rescan your patient ID if prompted. Remember to hit update charts, and that way your results are documented. Otherwise, kind of like hospital rules, if they weren't charted, they didn't happen. Verify any liquid doses with your instructor. Oh, look at this. This is perfect. This is the little message I was talking about right here. Wristband verification expired. Please scan the patients again before administering medication. And here we go. I can rescan it. And my patient's wristband has been successfully scanned and takes me to the MAR. That's a great little example. I'm glad that showed up. Remember to review any labs initially. You may have labs already. If not, you would have to call for them. You guys can review any trends and compare them side by side. You guys are able to call for any imaging and diagnostic tests, and they will be automatically resulted here on your computer. Remember to complete all your other checks. This covered mostly the third check and what to do there. But remember to continue on with all of your other checks, 7 or 17, however there are by the time you guys graduate. And you guys, that is it. That is how you guys are able to scan medications and administer them to your patient using our ATI system, and how you're able to view lab and diagnostic results on our ATI system. I hope this has helped, and I hope you have a great and wonderful rest of your day. Goodbye, everyone.